Welcome to Talk to Your Health. I'm Dr. Derek De Silva. Well, weightlifting may seem easy enough, but if you don't execute the proper form, it can really hurt your spine. Here to talk about preventing injury is Orthopedic Spine Surgeon Dr. Paul Vessa. He's with Somerset Orthopedics Associates, PA. Welcome to the program.
Thank you very much for having me on the show, Derek.
We think about the spine and we kind of take it for granted, but when you're lifting weights, why does that become so critical?
Well, spinal injuries, particularly injuries done during weightlifting, can often have dramatic impact on people's lifestyles. They're very, very easy to injure the spine, particularly disc herniations and problems with some of the lower joints in the spine.
Yeah, that was going to be my next question, was what are some of the more common injuries that we're seeing?
Typically, it depends on our age group. Those people that are generally younger, in their 20s and 30s, will often have disc problems, a disc herniation, which will then put pressure on the nerve and create what we call sciatica, or a pain going down the leg. As we start to get a little bit older, we have some changes in the joints in our spine, and we develop some arthritic conditions that can be exacerbated by improper lifting techniques.
And the typical reasons why we see these injuries?
Mostly it's form. And oftentimes, many of us are weekend warriors. We're not quite adept at lifting weights. We try to go in the gym and do some weightlifting without proper form, and perhaps we do too much and we overdo it. And so most of the injuries are usually just from people being a little bit too careless and a little bit over-aggressive with regards to the exercises.
And you know, it's interesting that you said over-aggressive and careless. One of the things that I see in my own practice are the 50-year-olds that think that they're still 20. And I think we forget the warm-ups. Could you just talk very briefly about warm-ups and things like that?
Actually, as we get older, it's more critical that we warm up. Usually when you're younger, you can get away with not warming up. But as we get older, you really have to get the muscles moving properly. You have to stretch them a little bit, the joints moving a little bit better. And those people that do that regularly will find that they actually work out a little bit better, and they tend to avoid these injuries that we're talking about today on the show.
And speaking of avoiding, are there any particular exercises that people, let's say, over the age of 50 should avoid?
I think that there are certain exercises in the gym that I see in my practice that tend to result in injuries that require treatment beyond just some anti-inflammatories and bed rest. And those exercises are typically deadlifts, overhead military presses, squats, and then the leg press machine is one of those machines that typically results in lots of back injuries.
Wow. Thank you so much for joining us. Great information. Pleasure to have you here. And folks, here's what we're working on for next week. And remember, you can catch 12 to Your Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m. Welcome to 12 to Your Health. I'm Dr. Derek De Silva. Well, last week we talked about preventing spine injuries when you're working out. This week we're going to show you the correct way to lift those weights. Joining us once again is Orthopedic Spine Surgeon Dr. Paul Vessa. He is with Somerset Orthopedic Associates. Thank you so much for joining us once again, Dr. Vessa. So again, just a quick recap, why is the spine so critical when we're working out with weights?
Typically, when we're working out with weights and we're exercising, it's a spine that we can injure in a way that will have a significant impact on patients' lifestyles going forward.
So let's get right to it. Thank you so much for joining us, by the way, Victor. It's a pleasure to have you. Tell me a little bit, can we just get into some of the mechanics of what should and shouldn't be done?
Yes, we talked about those exercises that typically create the most significant injuries, and the two that come to mind right away are deadlifting and military presses. So Victor's going to demonstrate good and bad technique.
Okay.
The first demonstration is going to be bad technique. When people deadlift, they pick up the bar, and then without hitching their back, they just stand straight up, just like that.
Okay.
The proper technique is to actually...
That's a disc waiting to pop out, right?
That is a disc waiting to pop out. It's a tremendous amount of axial load when you do that across the spine, and those are the cases where people will lift the most that they can, 2 or 3 times. They'll feel a pop, and then the next thing you know, they got pain running down their leg.
So what's the correct way?
The correct way is to actually do a little bit of a hitch midway through your lift. You hitch and then you stand. And if you notice, he's using his legs a lot more than he's bent at the waist. He's actually using his glute muscles back in here and his hamstring muscles and not lifting with his back.
Okay. What's the next exercise? You said the
military presses. Okay. Now, military presses are ones that people see routinely on all the programs on how to lift weights and whatnot. And the problem with military presses, what most people don't realize, is that people are dominant-handed. Either you're left-handed or right-handed. In this case, Victor is left-handed. So what happens with a dominant hand is the left hand will typically go up quicker. The right hand doesn't go up as much. And there's a twisting and extension moment to the lower back. And that's when they'll injure these facet joints back here. Okay. And those can be injuries that can be quite devastating.
So this is is wrong. You know, you have to make sure that both arms
go up equally.
So and there isn't.
Right. So choose lesser weight if you have to. Don't use the maximum amount of weight where one arm pushes up and the other one doesn't, and then you wind up with this twisting extension moment.
Okay. The other thing, very quickly, we're coming to the end of this. Please talk to me about warming up.
Warming up is critical, particularly as we start to get through our 40s and 50s. And the reason being is that our bodies are not as young as they used to be for obvious reasons. And we start to have some arthritic changes in some of the joints, and the joints generally respond better if they've got some blood circulating through them, and that's where stretching and warming up come into play.
Super. Gentlemen, thank you so much for joining us today. Pleasure to have you here with us.
Thank you.
Thank you.